Okay, and action.
Hi Claire, how you going?
I'm alright, how are you?
Yeah, good thanks. Had a busy morning, yeah.
Oh, I had a nice day.
Oh, did you?
Just been out for coffee.
Oh, I've been rushing around. It's been pretty busy. So I just need to hand over because I've got to go to an in-service after lunch.
Yeah,
so
no, that's cool.
Can I just hand over this lady? So this is Sarah McDonald. She's a 60-year-old lady. She's come in with pneumonia and she's basically come out of ICU this morning. So I haven't really kind of caught up on everything, but she's got a past history of heavy smoking and hypertension and diabetes.
Yep.
She lives with her husband at home. She's usually fully independent. So she got admitted with pneumonia. She'd been in ICU, but I think they had problems weaning her off the ventilator. Basically they did a tracheostomy.
Okay.
So she's come up here with a tracheostomy. She's got the feeds. She's on oxygen.
Is that the speaking valve?
Oh, I don't actually know if that's a speaking valve. Yeah, I'm not really sure. I haven't really had a chance to really read her notes yet. But look, she's a lovely lady, and yeah. So the physio said she'd come back this afternoon. I think yeah, I'm not exactly sure what's happening with the trachea at the moment, but we can have a look at the notes. And find out.
That's all right. I'll have a read.
Okay.
You go to lunch?
All right, cool. I'll see you
just
later.
one other thing. Did she get out of bed or anything?
Oh, I don't actually know. I think she might have sat out of bed. I'll just tell her who you are. Okay. Sarah, how you going? I'm just going to introduce you to Claire. Claire's one of our lovely grad nurses and she's going to be looking after you this afternoon. So I'm going for lunch now, so I'll see you a bit later on, okay?
Yeah,
all right, cool.
Hello, Sarah.
Just leave you there.
Oh, thanks. Hello, Sarah. How are you today?
Hi Claire, all right, thanks.
Good. Look, I'm just going to go and grab the obs trolley and come back and we'll have a look at your obs and things like that. So be with you in a little while, okay?
Okay.
Hello there, Sarah. How are you? Sarah? How are you?
A bit tired.
You're a bit
Just not
tired.
feeling that well.
Yeah, you look like you're breathing a little bit there, aren't you? Do you feel all right?
No, I don't feel like that.
We'll just see what your oxygen levels are doing. How's the magazine? Any good hot gossip at the moment?
Yeah, there's never much in these magazines.
See what your breathing's doing. Yeah, your oxygen levels are a little on the low side. Why don't you just try and take a few big breaths for me, Sarah? All right? It's the way. Check your blood pressure. Have you felt like this before, or is this just started now? Has it?
Oh, just earlier. About 15 minutes ago I started to feel like this.
Check your blood pressure. Yeah, just try a few more big breaths for me.
I'm a bit lightheaded.
Just going to pump this pressure cuff up for you. There we go. Yeah, it's a little bit high. You do have high blood pressure though, don't you, Sarah?
Sometimes.
All right, well, yeah, I'm just a little bit worried about your breathing. Just your oxygen levels have dropped off a little bit compared to what they were this morning. Well, look, why don't you try and have a few big breaths for me and I'll go and see if there's one of the other nurses around who can give us a hand, all right? I'll be back in a minute. So it's okay.
Hi Claire.
Hi, you're the physio, is that right?
Yeah, I'm Casey.
Oh, nice to meet you. So this is Sarah. I just started my shift and she's just really struggling with her breathing. She says she's not feeling that well and her oxygen levels are a bit low. So yeah, I just thought you might be able to give me a hand.
What about if we sit her up a bit to start off with?
Yeah?
Hi Sarah, I'm Casey, one of the physios. Claire probably mentioned I'm going to pop in and see you.
Okay.
Get the bed up.
How are you feeling now, Sarah? You all right? Just sitting you up. There we go. Is that okay?
Might move that.
There we go.
All right. Might have a quick listen to her chest while I'm
Yeah,
here.
no, that's fine.
Probably need an
Right
extra pair
there.
of hands to have a proper listen to her chest, but I'll just have a quick listen. Sorry.
Lift your arm up.
Sorry about this, Sarah. It's a little bit cold. Big breath for us. Good.
Yeah, it's okay. It's all right.
Just going to have a listen under your gown. Sorry, Sarah. Yeah, she's really quiet.
It doesn't sound like really quiet.
And it sounds like she's got a bit of secretions.
Look, I haven't really seen a lot of trachees before, but she does have this speaking valve on, so I wasn't really sure about suctioning.
Yeah, maybe we'll take the speaking valve off. I haven't seen that many trachees either.
Okay.
I've just started my rotation up here.
I'll put some gloves on.
Yep, I might grab some gloves too.
Want some gloves?
How much oxygen is she on?
I think she's on 40%. Yep. I mean, her oxygen levels this morning, she was sort of around 97, but as you can see, she's dropped right down.
Yeah, she's sitting on 87 at the moment.
Yeah, and her rest rate's been around 30 plus actually. So this speaking valve, do we just pull it off? I think.
Yeah, just be careful.
Just taking this off, Sarah, might make your breathing a little bit easier, okay? There we go.
And I think there's a container somewhere normally floating about.
Yep. So you won't be able to talk anymore, Sarah, okay? There we go.
Should we try
suction? There's a suction catheter. I think it should be on at the wall there.
I'll grab one more glove off you, please. We're just going to try a little bit of a suction.
It's all right, Sarah. Just take a few nice deep breaths for us. We'll help you. We'll sort your breathing out for you.
Just take
Hold that away. Yep.
bit of a cough coming. Yeah, it's a little bit stuck.
Yeah, there's a bit there, isn't there? Yes, I'm not really sure. What's her oxygen levels at the moment?
90, it's a little bit better. Can you try a bit of a cough for us? All right, good effort, Sarah. Look, I'm thinking maybe we should get ICU liaison up.
Yeah, I'm a bit worried about her. I mean, you know, she's definitely deteriorated since she came up from ICU, so yeah.
It's probably not a bad idea.
Sarah, we're just going to get one of the ICU nurses to come and have a look at you because we're a little bit worried about your breathing.
I might go and give them a call and if you want to stay here with Sarah.
I'll stay here. Maybe I'll give her another suction or something like that.
Yeah, I'll be back soon, Sarah.
Thank you. It's all right, Sarah.
Okay, so it's recording. Okay, go.
Hi, is that ICU liaison? Oh, hi Nicola, it's Casey here, one of the ward physios. I work up on Ward 4 West. Look, I'm just calling regarding a patient who's quite unwell at the moment on 4 West, bed 4, Sarah McDonald. Oh, you do know her? Yes, she's the lady who, the 60-year-old lady who came up from ICU after a failed extubation, and she's got a tracheostomy and she's come up here on 40% of oxygen. Yes, we have had to increase her oxygen requirements this morning and she's in quite a bit of distress at the moment. We're both quite concerned, both the nurse looking after her and I, because her oxygen levels have dropped within the last half an hour and she's in quite a bit of distress. Her respiration rate's quite high. Look, I'd really appreciate if you could come up and review the patient this morning. That'd be great. All right, fantastic. Thanks for that, and we'll certainly do the suction before you get up here, and we'll look forward to seeing you up here on the ward. Thank you. If you need to contact me, I'm on page 329. Thank you very much. Bye-bye.
Okay, thank you.
And you're going to come in the back side of me as well, so make it clear.
Yep.
Okay, in action.
It's okay, Sarah. It's okay. Just try and take some nice deep breaths for me. Slow your breathing down. That's it. It's okay. Oh, hi.
Hi, Claire. Look, I managed to get a hold of Nicola from ICU. liaison, and she's going to come up now.
Good. She's really struggling actually since she left. She's like her rest rate's up around 40, and she's just getting a bit hard to breathe, isn't it, Sarah?
Sarah, you look a bit clammy there, don't you? Look, we might, Nicola said to try another suction before she comes up. I'm just looking at her and looking at the oxygen levels. I might pop her up on to 50%.
Yeah, good idea. Because her sats have been below 90 now since she left, so... Whoops.
Hi.
Hello.
How are you?
Good, thanks for coming up.
That's alright. I got told to come up immediately, so I'll come up as quickly as I can.
Great.
I'm Casey from Physio.
I'm the nurse looking after her.
Okay, hi. So this is Sarah. Sarah, hi, I'm Nicola from ICU. I've just been asked to come up and see you because of your breathing. Yes, you're breathing very really fast and hard there. Yeah. Okay, so what have we done? We've done some suctioning.
Yep, she had the, the valve on.
Okay.
So the valve on. Yep.
And we're just about to do another suction. Did you want to do this one?
Oh, no, you do that. That's fine. I'm happy for you to do that.
But her oxygen levels have been below 90, and she's working really hard to breathe. So I'm really worried about her.
Yeah, I can see why you'd be worried about her. She is struggling a little bit. How much oxygen is she on?
She's on 50% now.
Okay, how long has she been on that for?
We've just bumped her up to 50%.
And oxygen levels
She
are...
was 87.
It's only sitting, only just barely 90.
It just feels a bit stuck.
Alright, okay, it's quite... Yeah, alright, what we might do is I'll just inflate the...
Sorry about that, Sarah.
That's fine, yep. So really
That's all done now.
Really thick stuff coming up the
Yeah,
trachea.
the nurse this morning said that she got heaps of sputum up this morning, but she only just came up from ICU.
Okay.
We've suctioned, like twice now, and just got a little bit of thick stuff, but like we said, it gets a bit stuck.
Okay, so I've just inflated the trachea cuff again, just to...
So how did you know how much air to put in that?
Well, what we do is we check it with the cuff thermometer, so I'm just going to apply that, and we like the pressure to be between 20 to 30 centimetres of water there. So,
okay,
yep, so that's
okay,
30.
Sarah.
So that's the cuff back up. So we're just trying to maintain a patent airway.
She did sound really quiet on the basis of her chest, and she had really coarse crackles in the upper zone, so I think she sounds like she's got plenty to clear, but I don't know if we're clearing that much.
Yeah, okay, alright Sarah, you're just working a bit hard there. What we might actually do, you haven't changed the inner cannula? No. Okay, so what I might do is I'm just going to pull out that cannula there. Oh, look at that, look how, so it's really, really crusty. Lots of, sputum.
Well, it's no wonder,
dried
really,
onto
no wonder.
So what's actually happened is her airway's been blocked, and that's how you haven't been able to get the suction catheter down. So what we might actually do is just suction her again.
Yeah. And she's picked up even.
I mean,
now, so she's sitting at 92%.
So what can we do to stop that?
But what I'll do is I'll just suction her now that we've got an airway. If you could pass me the suction. And she just needs like at least probably hourly suctioning for the next 4 hours. You could probably just pop on a saline neb as well.
Do you want to do one of those now?
Yeah, that would be great. We'll just do another full set of orbs as well. So big suction coming, Sarah, sorry, lots of suction out. And as you can see, really thick material being suctioned there.
Great to hear that.
Big splash.
So what we'll have to do is QID saline nebs at least. If you're finding that you're unable to suction, you need to change the inner cannula. The inner cannula has to be changed at least once per shift, or PRN really, as you want.
And should I get the doctors to write her up for saline nebs? Or?
I'll page the doctors. I can do that if you like. We'll just give her the saline neb.
And what about that speaking valve?
Today I wouldn't put the speaking valve back on her. I think the focus today is to actually just keep the airway patent. Lots of suctioning, lots of reassurance.
She looks a bit better now, don't you, Sarah?
She does actually. Her respiratory rates come down nicely.
Actually, her sats have come right up.
Fantastic.
What's she sitting at now?
Well, she's got the neb on, but they're up in the high 90s, so that's pretty good.
So the problem was pretty much that the inner cannula was blocked.
We both were.
We were really worried.
It's quite frightening, isn't it? When
she was getting so distressed
That's
as well.
Absolutely.
Sarah, you're looking a bit better by the looks of things.
So Sarah, we're not going to put that valve on that allows you to talk. What we're going to do today is just really focus on making sure that the airway is nice and clear. Lots of these nebulizers to sort of break up that really thick sputum that you've got there, because the girls were saying you've had quite a nasty pneumonia. So lots of antibiotics, lots of suctioning, and lots of saline nebs. What I'll do is I'll just pop in a clean inner cannula before I go. So we know that we have got a patent airway.
I'll go and wash that one.
Yeah, and we can wash out just with some saline, the other inner cannula. And I would just change that in 4 hours time and give regular nebs. And
I might catch up with her after this nebs run through and do some breathing exercises with her.
But what you done was right, setting her up, both right up in the bed, giving her more oxygen and trying to suction. The next time you would inflate the cuff, and you can check that with the manometer, and then also changing the cannula.
That I think was the key.
I think so. So all right. Well, she's now on my book, so I'll add her, do all the paperwork for her, and I'll come back in a couple of hours and see how she's going.
Thank you so much.
Okay. All right. I'll see you later.
See you
Thanks
later.
for phoning. Bye.
That's a bit better, isn't it, Sarah? Well, I'll leave you with her, and
all right, thank you.
I'll come around a little bit later and do some more ops on you. Okay? Thanks.
Cheers.